Join me as I take a challenge of raising awareness and support for our amazing healthcare workers. Let's see how much difference we can make together. Hello and welcome to my channel. I'm Nasmamli O, and I'm so glad you're here. This is a space where we break down medical topics, nursing experiences, and health tips in simple, clear, and engaging way. Whether you are a nursing student, healthcare professional, or someone who is just interested about health and well-being, you are in the right place. Last time, we talked about the experiences medical team, nurses, medical staff get from relatives and patients, the terrifying situations that they go through. This is a video of a follow-up of that topic. My goal, therefore, is to share knowledge, raise awareness about important medical issues, and make learning both easy and enjoyable. Together, we will explore diseases, disease prevention, treatment, and the incredible role the nurses play in patient care. So sit back, relax, and don't forget to subscribe for weekly content that informs, educates, and inspires. Welcome again to my channel. If you're a returning subscriber, I'm excited to continue this journey with you. If this is your first time here, hit the subscribe button. Feel welcomed to join the amazing family we have here so that you don't miss out on our new videos. Healthcare workers are the backbone of healthcare systems, dedicating their lives to caring for others. They work so tirelessly behind the scenes, often putting their own needs last. But their job isn't just about healing bodies. It's also about coping with the emotional toll of their work. High stress levels, long hours of work, and traumatic experience can take a heavy toll on their mental health. Despite their critical role, many healthcare workers face significant challenges that can affect not just their well-being, but also the quality of care they provide. One of the major issues they face is mental health problems. The high-pressure environment, combined with the emotional strain of dealing with patients' suffering, can lead to anxiety, depression, and even burnout. Long hours of shift work disrupt their personal lives, making it hard to maintain a healthy work-life balance. Additionally, they often lack access to adequate support systems, such as mental health resources or peer group support. The lack of support can make it difficult for them to cope with the stress of their job. Physical demands of their job are another significant challenge. Healthcare workers are in the front line of infection control, often putting themselves at a risk of contracting illnesses. They also face physical strains from long hours of their feet, heavy lifting, and repetitive tasks. Furthermore, they may encounter violent or aggressive patients, adding another layer of stress to the already demanding role. The challenges can have a ripple effect, impacting not just on the healthcare workers themselves, but also on the care they provide to the patients. The shortage of staff and resources is another critical issue. When healthcare workers are overworked and understaffed, it can lead to mistakes, decrease morale, and a decline in patient care. The situation can particularly be dire in rural and underserved areas, where resources are already stretched thin. The lack of support and resources can make healthcare workers feel undervalued and unappreciated, exacerbating the challenges they face. These challenges don't just affect healthcare workers, they also have direct impact on patients. When healthcare workers are burnt out and struggling with their mental health, they are less able to provide the compassionate, high quality care that patients need. For example, a nurse who's exhausted from working long hours might make a mistake with medication, or a doctor who's struggling with depression may have trouble connecting with their patients. The effects can be far reaching, leading to decreased patient satisfaction, longer hospital stay, and even increased mortality rates. I've heard stories from healthcare workers themselves about the toll their jobs takes on their mental health. One nurse shared that she felt like she was losing herself in her job and that the lack of support from her employer made it hard for her to cope. There are also real life examples of the impact of these challenges on the nursing staff. A doctor I spoke to shared that after years of work in high stress areas, he started experiencing symptoms of burnout. He felt exhausted, detached from his work, and unsure if he would continue his role. It wasn't until he received support from a peer group that he was able to find a way of managing his stress and regain a passion for his work. Stories like this highlight the need for the systemic support and community resources to help healthcare workers overcome the challenge they face. One powerful story that stands out is that of a nurse who was on the brink of burnout. She was working long hours, dealing with traumatic cases, and felt completely unsupported by her employer. But then she found community of fellow healthcare workers who understood what she was going through. They offered her emotional support, practical help, and a sense of belonging. With their help, she was able to find a way to manage her stress, prioritize her own well being, and continue doing the work she loved. Her story is a statement to the difference that community and systemic support can make in the lives of healthcare workers and the people they care for. If you've been touched by the stories shared in this video, I encourage you to share your own experiences in the comment below. Have you or someone you know been impacted by the challenges faced by healthcare workers? Let's keep the conversation going. And if you're interested in learning more about ways to support healthcare workers, be sure to check out on our next video where we dive into practical tips and strategies for making the difference. Remember to subscribe, like, and share. Thank you for watching.